So this is just to set the scene for my presentation. And Dawai ke badle zehar, ilaj ke badle maut kyun? We want justice. Glimpses of grief from families of HIV-infected children at the Karachi Press Club recently. If we look at the global perspective, there are 40.8 million children, people living with HIV in the world, with the graph coming down. And from 1990 till 2025, you see that both the number of infections and the number of deaths have decreased. So if you compare this global graph with the world, with Pakistan, we have a 200% increase in the number of cases from 2010 till 2024, which is a 200% rise, and Pakistan is the fastest growing HIV epidemic in the whole of Asia. And in the number of deaths as well, there has been a 524% increase in the number of deaths overall from 2010. And these are the WHO UN-8 targets. 95% of PLHIV should know their status. 90% should be on ART, which is the drugs used today to suppress HIV virus, and 86% should have the viral load suppressed. If you look at Africa, Kenya being in Africa, and we had the keynote speaker from Kenya, Africa is performing the best as compared to all the other regions of WHO. And EMRO, where Pakistan lies, is the worst. In Pakistan, it's not that we have not scaled up our services. There has been an 8-fold increase in the people who are on ART, and they have been from 13 centers to 95 centers formed till 2025 by the joint efforts of government, UN entities, and partners. However, this is still the tip of the iceberg. Why? Because if you look at Pakistan's HIV crisis, we account for 57% alone. We alone account for 57% of the burden of the EMRO region, and 21 countries are 43%, right? And if we compare our targets, what we have achieved as compared to what we should achieve, only 21% of people who have HIV know their status, which means 8 out of 10 don't know they have HIV. This is the main driver of the epidemic in Pakistan, because many physicians don't know how to diagnose HIV, and the patients, they are going to different clinics, sometimes skin clinics, sometimes different clinics, and they are not getting diagnosed. And then only 16% are on ART, and only 7% have their viral load suppressed. If we break this up in children and adults, 38% children and 15% adults only. And in women who are pregnant, only 14% of HIV positive women in Pakistan are on ART. So this is very sobering data, which explains why WHO is worried. This is from their page in 2025, from their walk, where they said they called for action to reverse the spiraling trajectory of HIV in Pakistan, and this is very important. In Pakistan, children have been exposed to HIV through unsafe injections and blood transfusions in recent outbreaks in Shaheed and Benazirabad, Hyderabad, Naushera Feroz, Pathan Colony, Tausa, Mirpur Khas, Jacobabad, Shikarpur, and Larkana. In several of these outbreaks, over 80% of detected cases involved children. So as Dr. Elizabeth mentioned, the HIV epidemic in Pakistan is concentrated with these key figures. From 2021, we have in Karachi, 48%, in Kasur, 52% of people who inject HIV, inject drugs, who have HIV. An unchecked epidemic is going on. And then the transgenders and MSM and others, these are 2021 data. I don't know what the figures are now, because it might be even higher. We don't have the current stats. Then from there, it goes to the bridging population with their sexual partners, and from there, it is spilled over into the general population through different transmission pathways, healthcare being one of them, because of which we see periodic healthcare-associated outbreaks. Overall, the general population estimates are of 0.2%, but we don't know exactly, because these are just estimates. So the main pathways through which healthcare contributes, three main major things: unsafe injections, sharps, unsafe blood systems. In unsafe injections, we know that we are among the highest, one of the highest injection users in the world, around 13 injections per person per year, 1 in 3 of those being unsafe. And these are published data of around 38 to 50% syringes being reused. And then the other main menace is the multi-dose vials, which are used especially in children, because one vial can provide dose to 5 children, 6 children, because they are small. So when a vial gets contaminated, even if you use a fresh syringe, the vial is contaminated. So IV saline drips as diluents, if they are contaminated and you're using a large diluent drip to dilute, then that is also a very big problem. Needles are frequently left in the septum of the vial, which contaminates them not only with HIV and others, but also with common staph aureus and others. And we see a lot of bacteremias and healthcare-associated infections because of those. Then we have sharp injuries. These are directly impacting healthcare workers. If you look at that, our data, 66 to 77% of needle stick injuries occurs, which is a very high rate. Only 38% of those are reported. 90% of healthcare workers who had needle stick injuries, this is published data, did not wear gloves. 44% were vaccinated only for hepatitis B. And then there is an improper disposal of contaminated sharps. Then we have unsafe blood system. There is no national blood transfusion service in Pakistan. Only 10 to 13% of blood transfusions are voluntary, which is a safer way of transfusion of blood collection. Most of the onus of collecting blood is on families, which is through replacement donors, and replacement donors have documented more infection rates for HIV, Hep B, and Hep C. And to add to the problem, most of our blood, even if it is screened, is through rapid tests, which are not recommended. 50 to 60% of the blood is tested through rapid tests. Only NAT, which is the preferred and recommended modality, there are only 4 to 5 sites in Karachi, only 2 in Lahore, 2 to 3 in Pindi, none in Balochistan or KPJ. So this is how blood is screened. At least we should be using CMIA or CLIA if we are not able to use NAT. So about the documented healthcare outbreaks, this is a very good article, which till 2009, 5 documented big, large outbreaks which are healthcare related, Ratodero being the biggest one. Apart from that, but you can see that they are from across Pakistan. So this is not just a Karachi problem. This is not just a provincial problem. It is a problem affecting the whole country, because it is a problem affecting our health system. And after that also, after Ratodero, even though we came in the limelight, we have still had so many outbreaks after that. So Ratodero basically brought us into the limelight, and this was one of the largest pediatric outbreaks, which shamed us internationally, and it was reported in Lancet, around 1,500 children overall, 80% of those being non-vertical healthcare associated. And after that, there was a firefighting response, and we saw that the government came in action, and around 300 clinics were closed down, 3 blood banks were also closed down. But then somehow, even 7 years after this international embarrassment, the unique and alarming trend of large number of young children becoming infected through unsafe medical care intermittently manifests at different places. And these are all very recent newspaper cuttings. Karachi, Sindh. This picture is very problematic. This is BBC, and Asma, 10 years old, her whole face is shown with her name. So ethically speaking, I find this very problematic. Then we have this whole Valika thing blowing up, where there were initial attempts at cover-up for months. The HIV status of children was even hidden from their parents, as per official inquiry. And only when they moved court was an inquiry done. And then after that, the second hospital, which also comes into in the Valika under labor, the Social Security Hospital, there is investigation over there, and we know this to be true because patients are coming from there to us at Indus. So and then Hyderabad. So the thing goes on. Infected, ignored, isolated. These are parents from the Valika Hospital. where they are saying that life has become hell for their children. The children are not being picked up, they are not being played with, they are not being enrolled in schools. Then parents are losing their jobs, and even neighbors are turning them out, they are isolating them. So these are all very real stories of social isolation, and even there, the response is not good enough because they have created an AIDS isolation ward at Walika Hospital. And 9 months after, even after such scrutiny, 9 months after HIV outbreaks, Sindh Healthcare Commission, was recent in July, they did a follow-up audit and they found serious lapses at Walika Hospital still, even after the scrutiny. And the inspection team observed that needles were being manually removed from syringes after use instead of being discarded directly into designated sharp containers. Even more concerning, technical staff could not explain where the removed needles were ultimately disposed of. So these are the root causes of the problem because of which the problem keeps recurring. So if all of this was in the news and from around, what is our own data? This is our own HIV data from Indus. This is our adult data. We are the second largest center in Karachi for HIV after the civil center. And if you see from 2020, it's not that the number of cases is going down, it is because more centers were created. So that's why you see this dip. It's not actually a dip. Even after so many centers, we still have a regular flow of patients which are coming in. And out of these, we've had around 9.6% of adults also who have healthcare associated HIV. The biggest, obviously, is sexual and injecting drug use. And injecting drug use is a very problematic group because they keep on defaulting. They don't turn up on time. And they sometimes are on ARTs. They are sometimes not on ARTs. So they keep on transmitting, and the virus gets on becoming resistant. And they keep sharing needles and stuff. Then the occupational exposure. This is a life-changing thing. I can't stress enough of a health professional, doctors and nurses, if they get HIV, how psychologically impacting it is. We have got 4 of them, and the number can increase because of the risk factors that I talked about before. This is our seroprevalence of whatever HIV testing we are doing. 3-4% come out positive. From across the hospital, the number of tests which are done, around 4% come out positive. So mortality-wise, in adults, we have had around 26% mortality overall since the start. And if you look at the age group is skewed towards the younger population, which is the most productive years of life, obviously. And they have come in with stage 4 or stage 3 diseases, life-threatening opportunistic infections. Why has that occurred? Because they were diagnosed late. If they come in stage 1 and stage 2, they would have a very healthy and happy life. And to reach from stage 1 to stage 4, you need an average of 10 years. So for 10 years, these people have been, or 5 to 6 years at least, they must have been spreading the disease in the community. So now this is the most sobering part of the data, and almost I'm finishing up with my presentation. This is our enrollments of pediatric cases. We did not have a pediatric center before August 2025. When we opened it, from then till now, we've got 129 cases, and this was the most alarming thing, right? And the trend is a steady trend we see. I was not expecting these many number of children getting HIV, and the age distribution is more disturbing because this is no way can you expect sexual transmission in children less than 5 years, and we have got 78 kids less than 5 years. Okay? And the modes of transmission, only 13 children have it from their mothers. 98 kids have got it through healthcare. And these are not all from Walika. These are not all from security. This is not a problem of one hospital. Okay, obviously, the data is more from Landi, Korangi, because this is our catchment area. But we have interior Sindh, we have got Balochistan, we have got other areas as well, children coming from there. They are not all from Velika Hospital, and the mortality is obviously more skewed, again, to less than 5 years because they are more complicated. So this is very sobering data. To recap, a trip to the doctor should be a sanctuary to healing, not an origin to lifelong harm. So all of these practices need to go if we want to have any headway into the problem. No quack should operate without accountability. No needle should touch its patient's skin unless it is seen to be unwrapped from its sterile seal. And strong IPC practices are needed at facilities to reverse the spiraling trajectory of healthcare-associated HIV. We frequently see these scenes at our hospitals. The needle safety is simply non-existent, and we see medical waste being dumped at different places. And this obviously then gets reused. And from fear to compassion, a simple handshake helped challenge fear and misconception in 1987. Pakistan must continue the same journey, replacing stigma, discrimination, social isolation with knowledge, empathy, and inclusion. So I close with this. Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it is the only thing that ever has. Thank you.